Welcome to TelehealthFX Talk. If you've been writing off GLP-1 medications because you don't primarily think of yourself as someone who needs to lose weight, but you do have arthritis, or chronic joint pain, or sleep apnea, or you just feel chronically run down and inflamed, this episode is going to reframe everything for you. Today we're covering one of the least talked about properties of semaglutide and tirzepatide, their profound anti-inflammatory effects. And we're going to walk through what the data says specifically for arthritis, for sleep apnea, and for chronic pain. If you want a clinical team that looks at your full metabolic picture, not just the scale, visit TelehealthFX.com. That's TelehealthFX.com. Let me set the foundation with one biological concept that ties this entire episode together. Chronic low-grade inflammation is the root driver of most major chronic diseases: heart disease, type 2 diabetes, osteoarthritis, sleep apnea, many autoimmune conditions. Even Alzheimer's is increasingly understood to have a neuroinflammatory component, and obesity is at its core an inflammatory state. Visceral fat, the deep belly fat surrounding your organs, is not inert tissue. It is metabolically active. It continuously secretes inflammatory proteins called cytokines, things like TNF-α and interleukin-6. Every day you carry excess visceral fat, it's running an inflammation engine in your body. So what does a GLP-1 medication do to that? It fights inflammation through two distinct mechanisms. The first is indirect. By reducing visceral fat through weight loss and improving insulin sensitivity, GLP-1 medications shrink the cellular machinery that is generating the inflammatory signals in the first place. Less visceral fat means fewer cytokines. Lower blood sugar means fewer glycation products, which are sugar-damaged proteins that trigger additional inflammation. The inflammatory fire starts to cool. But here's the part that makes this scientifically extraordinary. The second mechanism is direct. GLP-1 receptors don't just exist in the gut and the brain. They exist on immune cells, specifically monocytes and macrophages, which are the immune system's frontline responders. When semaglutide or tirzepatide activates those immune cell receptors, it directly inhibits the expression of pro-inflammatory cytokines. The drug is reaching into your immune system and telling it to stop overreacting. Multiple meta-analyses of clinical trials have confirmed this through significant reductions in high-sensitivity C-reactive protein, which is the main blood marker we use to measure systemic inflammation. And critically, these CRP reductions are observed before significant weight loss has occurred, which tells us this is a direct drug effect. It is not just because you weigh less. So what does this mean for joints specifically? The STEP 9 clinical trial evaluated semaglutide in obese patients with knee osteoarthritis. The results showed significant improvement in both pain and physical function. Now, some of that improvement makes intuitive sense. If you're carrying 30 fewer pounds, your knees are under less mechanical stress. But the improvement exceeded what would be predicted by weight loss alone, pointing again to the direct anti-inflammatory effect on the joint environment itself. And scientists have actually found GLP-1 present in synovial fluid, the lubricating fluid inside your joints, which suggests these medications may have a direct local anti-inflammatory effect on joint tissue. For rheumatoid arthritis and psoriatic arthritis, the picture is more nuanced. These are autoimmune conditions, and GLP-1 medications are not a replacement for the disease-modifying drugs that treat the underlying autoimmune process. But data presented at the American College of Rheumatology Convergence in 2025 suggested that RA patients on GLP-1 agonists experienced fewer disease flares. The likely mechanism is that by reducing the metabolic inflammatory burden, the whole body inflammatory fire, the overall demand on the immune system decreases, and the autoimmune flare activity quiets down. It's not treating the autoimmunity directly, but it's removing the metabolic fuel that amplifies it. I also want to flag a nuance here for people who are considering GLP-1 and have gout. Rapid weight loss from GLP-1 medications can actually trigger gout flares initially. As fat cells break down, they release uric acid into the bloodstream, which can deposit in joints and cause a gout attack. This is temporary, manageable with clinical monitoring, and certainly doesn't outweigh the long-term anti-inflammatory benefits. But it's something your provider needs to know so they can monitor your uric acid levels during the initial weight loss phase. Now let's talk about sleep apnea, because this is one of the most exciting new indications in the entire GLP-1 story. Obstructive sleep apnea, which is where excess tissue around the airway collapses during sleep and causes repeated breathing interruptions, is directly caused by obesity in most patients. It's one of the most undertreated conditions in America. Tens of millions of people either don't know they have it or know they have it and refuse to use a CPAP machine. And it is silently destroying your cardiovascular health, contributing to hypertension, raising your risk of heart attack, and damaging your cognition. Tirzepatide has now demonstrated such dramatic reductions in the apnea-hypopnea index, the measure of breathing disruptions per hour in clinical trials, that it has received regulatory recognition as a treatment for obstructive sleep apnea. This opens GLP therapy to an enormous population of patients who might never have gone looking for a weight loss medication, but who desperately want to stop snoring, stop relying on a CPAP machine, and wake up actually rested. And this is the big reframe of this episode. GLP-1 medications are being treated by the media as a weight loss drug, but the biology is telling us something very different. They are systemic anti-inflammatory medications that also cause weight loss and lower blood sugar. They protect your heart, your liver, your joints, your airways, and your brain by extinguishing the chronic inflammatory fire at the root of most of our major chronic diseases. The scale is just one metric of what they're doing. And understanding this full picture is exactly why you need more than a prescription from a telehealth mill. TelehealthFX providers look at your complete metabolic profile. They look at their CRP and inflammation markers. They connect your joint pain, your sleep quality, and your blood sugar together as part of the same metabolic dysfunction that GLP-1 can address. And they combine GLP-1 with complementary therapies, like NAD+, which has its own cellular anti-inflammatory and repair properties, sermorelin for lean mass, and berberine for insulin sensitivity. 24-hour provider review, one-on-one onboarding, transparent pricing, no hidden fees, 2-day UPS shipping. Visit TelehealthFX.com. That's TelehealthFX.com. You might be coming to GLP-1 because of your weight, but you might stay because of your knees, your sleep, and your heart. These drugs are doing far more than you've been told. If you are ready to treat the root cause instead of just the symptoms, visit TelehealthFX.com. That's TelehealthFX.com. Take the free qualification quiz and talk to a provider who sees the whole picture. That's TelehealthFX.com. And as always, everything on TelehealthFX Talk is for educational purposes only. This is not medical advice. GLP-1 medications are not primary treatments for autoimmune diseases. If you have arthritis, sleep apnea, or chronic pain, please involve your specialist alongside your prescribing provider. Individual results vary. Thanks for listening. Share this with someone who lives in chronic pain and doesn't realize there's a medical intervention addressing the root cause. We'll see you next time on TelehealthFX Talk.